For little ones at Children's Hospital this morning. We are closely following the developments on Capitol Hill regarding the Senate's early morning vote to push health care reform forward. Now, if the vote Christmas Eve goes as expected, the next big step will be to merge the Senate version with the House version that was passed last month. Joining me now is Congressman Michael Burgess. Congressman, thanks for being with us.
Glad to be on with you, Shelley.
You are quoted as saying you don't even think this is about health care anymore. Quote, it's purely about ideology and strengthening a hold on political power. How so?
Well, you know, I sat and listened to some of the reading of the bill or the amendment on the Senate floor on Saturday, and I practiced medicine for 25 years. I didn't hear a word about health care. I heard a lot about politics, and I heard a lot about consolidating political power. That's what all these car votes are. That's what all of these bribes are to get the senators and members of Congress to vote for it. This is all about delivering a product to the president's desk so he can sign it before the State of the Union address and deliver on that promise to have changed health care in America before his first year is up. Unfortunately, the change we're going to get is not the change we bargained for.
Let me ask you, we keep hearing how different the Senate's version is from the House version. How long is it going to take, do you think, to merge both of those ideologies?
5 years.
5 years?
No, I'm just kidding. What do I expect to happen? I expect that they will bring the Senate bill to the House, and we'll have to vote on the Senate bill. The Senate bill that's being worked on now actually has a House bill number so that they can simply bring it forward into the House. We have to vote on concurring with the Senate amendment. That means we don't get to change it. It's just a simple majority, 218 members of the House ratify whatever the Senate does, and off it goes to the president's desk, and we'll deal with any problems later.
How do you think this is going to change America's future if things stand as they are right now?
Well, it's going to make it very, very difficult just to practice medicine. It's going to make it more difficult for patients in this country. You know, we lose sight of some of the very things we should have been fixing, that people were asking us to fix. The whole problem with pre-existing conditions. Guess what? Nothing happens until 2014, and yet there were plenty of bills out there that would have started this process much more quickly. Senator McCain last year argued for using the best practices in state high-risk pools. There are reinsurance programs that could be used at the state level. The Congressional Budget Office estimated it would cost $25 billion over 10 years to deal with this problem. Not $2 trillion, $25 billion. Why we didn't do that, I'll never know. But as a consequence, we're going to have higher taxes day one, and maybe we'll get some benefits 4 years later. But even that's yes, because guess what happens to the doctors on January 1st of this year because of what the language in this Senate bill. Every doctor in this country gets a 21% pay cut.
Well, there's a lot to definitely work out. Thank you so much, Congressman, for your thoughts. I appreciate it. And as always, you can get the latest on